You are tuned in to Recovery TV, the voice of hope. Discussions and information on addiction and mental health issues. Here is your host, John J. Tassoni Jr., with today's guest.
Welcome to Recovery TV. I'm your host, John Tassoni. The voice of hope is here today. My guest today is Beth Bixby from the Tides Family Services. And Beth is the president and CEO. Welcome, Beth, and thank you for joining us today.
Thank you, John, for having me today.
And also, thank you for being a sponsor of this show.
We're happy to be a sponsor.
Great. So, Beth, tell me about Tides Family Services. What is it all about?
Tides Family Services is a community-based organization. All the work that we do is in the homes with the kids and families. We take a non-traditional approach to really meet kids and families where they're at. We are located throughout 6 sites in Rhode Island: Pawtucket, Central Falls, Providence, West Warwick, Middletown, and Wakefield. But really all the work that we do is in the community and in the homes, and we meet the kids where they're at. If it's at the basketball court, we meet them there. At school, whatever it takes. And that's one of our taglines: we do whatever it takes.
That's a great tagline. You know, one of my pet peeves over the years in the General Assembly and now in the field is that I don't believe that we have enough services, especially residential services, for our kids. And obviously, the kids are more important. Family is more important to work with the kids if, in fact, they have substance abuse and mental health issues. Mm-hmm. This is a game. This is a game where you put all the pieces to the puzzle together in order to get these kids through it. And I'm extremely proud of Tides Family Services for doing this, because there's not many out there that do it. And your organization's been around for a long time. How long have you been the president and CEO there?
I've been with the agency for 21 years, but I've been in this role just a little over 3 years. I succeeded Brother Michael Reese, but I have done every role there is throughout the organization: direct service, clinical work, as well as all the administrative tasks.
So let me ask you this question: what is your vision for Tides, since you're a newbie?
My vision for Tides really is to really promote community-based work and prevention. I think prevention is really critical. I see, there's been a lot of studies done where there's an over-reliance on inpatient care, and the outcomes are not as good. And so my vision is to really promote home and community-based services to really get to kids and families before they need higher levels of care, or they're in and out of the hospital due to mental health issues. And a lot of times kids end up at the emergency room and it's really not necessary, or there's police or emergency intervention, which is traumatic. Mm-hmm. A lot of times, and I'm really concerned about the secondary piece of the pandemic with a lot of the behavioral health challenges that we're seeing, where hospitals are overloaded, and now that schools are starting, will the schools have the capacity? There are some kids that have not been in person for a year, and that's a long time for a young person.
Right. Are you seeing the effects of COVID rising in the amount of people that you're treating?
We are. We have, the phone has been ringing off the hook, and one of the issues that is really disheartening is that we don't have capacity. And so not just ourselves, but there's a workforce shortage across the sector. So therefore, we're getting calls, and there are times where you have to refer them to a colleague, and then they don't have capacity as well. And that's when kids end up in the hospital, and it's really not needed. And then when they come out, there's nothing for them. And so we really need to work on how do we come together to address some of these workforce issues.
Now you say workforce. There's a lot of different scenarios to workforce. Mm-hmm. Is it because the rates are so bad that you cannot hire individuals that have to have a master's degree or associate's degree? Is it because there's other food establishments that are paying more money than you are? I know your budget constraints. I know you're a nonprofit, but are the rates a hindrance to Tides?
They are.
Tell me why.
The rates have not been increased in many, many years, and they do not allow an organization to sustain an infrastructure or pay a rate of pay where folks would get in another industry. So we're losing staff across the border to Massachusetts, the hospitals, and the public sector. Those are the three areas we're seeing people go.
You know, I was looking at an email a couple of days ago pertaining to one particular hospital that was looking for nurses and a $25,000 bonus to sign on. That's unsustainable for a nonprofit. It's unsustainable because if you have to hire 6, you're already in the hole $150,000 where the door hasn't even opened yet.
Correct.
So how difficult is it to do retention when you're not getting the funding that you need?
It's very challenging. We belong to an association, and I believe the vacancy rate is 35% right now, and that's all providers that are working directly with children, and it's our most vulnerable population.
Is it more, I mean, you know the statistic better than I, but is it more the inner city kids than the suburban areas?
It's everywhere.
It's everywhere.
It's not one place more than the
other. How
other.
about male, female?
We're seeing a lot of females for a lot of the more behavioral health issues, depression, isolation, eating disorders. With males, it's a lot of acting out behaviors where they end up getting themselves into trouble and engaging in the system.
And school starting this week, next week.
Yep.
I mean, it's going to be very difficult.
It's going to be very busy.
Very busy. So how do you bring the train down the tracks if you don't have the appropriate folks for jobs that need to be filled? How does that happen?
I mean, now we're on the brink of a crisis throughout the sector. I can speak for Tides. We have administrative level staff who are licensed, taking cases to try to help offset the burden, and we don't want to turn anyone away. When people come to us, they're in a crisis, and so they need someone. The other thing we've been doing is really trying to partner with some of the local colleges and universities. We have a large internship program where we try to attract the interns to apply later on, but there's not a big talent pool out there. It hasn't been an attractive field to begin with, and I think we've really got to do a better job early on, even before kids are considering going to college, to say that this is a profession that is purposeful, meaningful, and you can make a difference. And I think we also need to change policy. We need to advocate with the General Assembly to really understand what we're up against and what kind of crisis we could face for adults and children, because adults are the parents of the kids we serve. And
on our next segment, I want to talk a little bit about what we're seeing with parenting right now, and in your organization as far as overload. So you're listening and you're watching Recovery TV. I'm your host, John Tassoni. We'll be right back with Tides Family Services right after this.
My first experience with addiction was actually with a family member. And I was very young at the time. I didn't really understand everything that was going on, but I knew that it really rocked my family to the core. Now, thank God that family member got the help that they needed. Sometimes you get yourself backed into a corner and feel like you've got to do it alone, but I think it's important for those people that are in that situation right now in their lives to understand they don't have to do it alone. You can make it through this. You can get back on track.
Serving the community for more than 30 years, 3 generations of our family at Wesco Oil have been providing reliable comfort to your home.
From oil delivery to installation and service, you can trust us to maintain your heating and cooling systems year-round. Visit us at bewarm.com to choose an option that best meets your needs. Be cool or be warm. We've got you covered. Honest service at a competitive price. Wesco Oil Company.
Treatment is often far more successful when individuals are offered both medication and behavioral therapy. Kodak Behavioral Health Care is Rhode Island's largest, only nonprofit, outpatient provider of care for opioid use disorder.
Our compassionate clinicians deliver the highest level of care for patients.
Through Kodak's medication-assisted treatment program, patients are prescribed methadone, buprenorphine, Suboxone, and naltrexone. For a confidential conversation, call Kodak.
Local 57 Operating Engineers is Rhode Island's source for professional heavy equipment operators. For the last 120 years, Local 57 members have worked on all of Rhode Island's major construction projects, including buildings, roads, and bridges. If you're looking for professionally trained and licensed operators to run your excavators, loaders, cranes, or any other type of construction equipment, give us a call at 421-6678. If you're an experienced heavy equipment operator and would like to join our team, give us a call.
The Parent Support Network is committed to supporting and assisting peers. Together, they're working with statewide and national partners to empower children, families, and individuals through dynamic supports, education, and advocacy to prevent abuse and neglect and progress toward universal health, wellness, and recovery. A location is near you: Child and Family Visitation and Training Center in Warwick, Hope Recovery Community Center in Middletown, Hope Recovery Community Center of Washington County in Westerly, or online at psnri.org.
Welcome back to Recovery TV. There's a voice for hope. Beth Bixby's in the house today, and Beth is with the Tides Family Services, and I love the motto, never give up on a kid, never give up. Beth Bixby, thank you for joining us, and thank you for Tides for being a sponsor of Recovery TV.
Thank you, John. We're very happy to be a partner with Recovery TV.
Thank you. I want to talk a little bit about something that when you go out and you have conversations with people, the issue of kids being brought up in today's society. They're not being brought up like we were brought up, where you had to be home when the street lights were on, you had to eat your supper, you had to do your homework, and you behaved in school. Now it's all sorts of things going on. What's your thought about parenting? And how can parents help the situation? This is the key to Recovery TV. Give people tips. Know where to go to make the phone call if your child is acting out. Call Tides. Call Beth Bixby. Talk to a counselor. Tell me about that.
Sure. I mean, we get calls from parents on a variety of issues. Kids refusing to go to school, kids not coming home, kids failing school. We do a lot of educational advocacy at Tides, because a lot of times when kids are acting out in school, it typically means that their needs aren't met, but they don't know how to really express them. They don't know how to articulate it. And so we do a lot of work around that. But to answer your question, John, I think one of the things with today's society, and I think as adults we saw it with the pandemic, is there's really no boundaries anymore, especially when using virtual platforms and social media and texting. You know, kids thrive with structure, predictability, and consistency. And I think, you know, especially with the change in how we're doing things, there is no boundary. There's no start or finish to a day, where, you know, that can be confusing for kids. And I think they're overstimulated. You know, they're not releasing energy. You know, a lot of things that, you know, when we were growing up, things were more physical.
Right.
Kids, there's a lot of isolation. You know, there's no real way to practice social skills. You know, in school or being part of a group or a sports team, you learn how to handle disappointments, problem solve. You learn how to negotiate. Now we have kids, you know, that are behind the keyboard, and it really puts them at a disadvantage. And so some of the stuff that we do at Tides is we do have social skills groups. We do bring kids out into the community to work on some of those issues, to really help them integrate into the community. You know, when you're looking for, you know, a job, they call it soft skills. And so really that's what we're teaching a lot of times, is some of those soft skills, things that we took for granted.
What about the phone? The kids today hide behind text messaging and other uses of the phone. Should there, in your estimation, be a limit on how much time a child should utilize their phone?
Well, I think a limit or just parameters around it. You know, I think that it's more of a supervision and monitoring issue, like with anything. So these days it's the phone. Years ago it was something different. So it really goes back to supervision and monitoring, the parents trying to be involved as much as possible. I mean, you can't control everything in life, and sometimes, you know, there's natural consequences, but it's just like, you know, when a kid's driving a car, you don't know what's going on in the car, what they're up to, and so it's really putting parameters and boundaries around it.
You know, you said something a few seconds ago that just stuck to my head, pertaining to parameters and having discussions with your child on a daily basis. You just can't come home and give your son or daughter a sandwich and say, okay, you can go to your room now, because you gotta ask the questions. How was your day? What's going on? Anything bothering you? You know, how long have you been on the phone? I mean, have you been outside to play? You know, when we, again...
Who did you eat lunch with today at school?
Exactly.
You know, who did you play with at recess? Or, you know, I saw there was tryouts for X, Y, and Z. Are you going to participate?
Right.
It's really about connection and having that relationship. Because I think that's what gets lost, you know, and really trying to have a sense of community.
You know, when I was in the General Assembly, we went out, we did a whole bunch of interviews for bullying in schools. And I was amazed when people came in to testify about what they talked to their children about or what they didn't talk to their children about. And that's when the phone started to really take off, text messaging and bullying online, and then bullying on the phone, because you don't have to be face-to-face anymore. It's all about,
not at all.
It's all about a text message or an email. So there's, you know, the teachers, they give the teachers a hard time, but the teachers now are becoming parents in school. They have to nurture the kids. They have to make sure that they know the rights from wrongs. When we were growing up, there was not a lot of single parents. Today it looks like almost every household is a single parent.
And we also see a lot of grandparents raising grandchildren, especially related to the opioid epidemic. And so there's a challenge within itself, you know, where they weren't really prepared, and there's a wider generational gap. And so we also see that as a struggle as well. But I think, you know, back to your point, you know, I think there needs to be a village. You know, teachers are with students for 6 hours a day. The academics are just as important as the social emotional learning.
Right.
And I think, you know, there's a movement to try to really promote social emotional learning and being trauma informed in schools, which I think is critical to have the teachers equipped to manage those things and to really establish a balance. You know, it's EQ versus IQ. You know, I think you have to have a good balance of both.
Yeah, and the balance is very important, because it can't be lopsided.
No.
If it's lopsided, that's when you run into problems.
Exactly.
And when we, as youngsters growing up, we had the balance. We had the balance. But as far as today goes, life is so fast. More issues on the phone, computers. There's really no balance. It's like 75-25 now. And that's what's causing the problems. We need to get back to basics.
Exactly.
In school. You know, we need to get back to basics. And if we don't get back to basics, if we're here 10 years from now, you and I, talking on the same show, we're going to be in serious trouble.
We definitely are.
Serious trouble. So you're listening to Recovery TV. I'm your host, John Tassoni, the voice of hope. We'll be right back with Beth Bixby of Tides Family Services right after this.
I started getting in trouble when I was real young. I was bringing knives to school in the 3rd grade. I started hanging out with the wrong crowds. I envisioned that if I wasn't dead by 26, I'd be in jail. I never had plans past that. Tides give me the opportunity to start a new life fresh. So now to be 28 with 4 children, married, manage this restaurant, living in a house, it's a miracle. Life is incredible, and Tides is who I have to thank for that.
If you or someone you know is struggling with a mental health or substance abuse issue, the members of Horizon Healthcare Partners are here to help. Kodak, Community Care Alliance, Newport Mental Health, Thrive Behavioral Health, and Tides Family Services serve the behavioral health needs of all Rhode Islanders. We also operate BH Link, the state's 24/7 behavioral health emergency center. For help, call the 24/7 hotline at 401-414-LINK. For more information, visit Horizon Healthcare Partners at hhpartners.org.
Addiction Recovery Institute with locations in Pawtucket and Warwick have been the leaders in treatment of opioid use disorder since 1993. Addiction Recovery Institute offers same-day admission, no waiting list. Services include medicated assisted treatment, detoxification, and substance counseling, always providing care to those who are most in need with dignity and respect. For more information, visit methadone.com.
Alcohol and drug addiction, depression, anxiety, PTSD, they can all seem overwhelming, but you don't have to face them alone. At Trinity Village, we are committed to providing addiction treatment that works. We specialize in offering integrated care for co-occurring mental and substance use disorders. We offer cutting-edge medicated assisted treatment and medication management. We are now offering virtual care to get the treatment you need from the comfort of your home. If you or someone you love needs help, call or visit us online at trinityvillage.org.
You know, every week I work in stadiums filled with thousands and talk to thousands more on the radio, which means people who come from every walk of life. And I know that many, like my own family, have grieved over loved ones caught in the grip of addiction. 8 years ago, we lost my nephew to an overdose. But I've also seen in friends and even fans who've shared their stories, others break that hold and regain control of their lives. You can do the same. Please know you're not alone.
Welcome back to Recovery TV. I'm your host, John Tassoni. This is the Voice of Hope. Beth Bixby's in the house today from the Tides Family Services. Beth, welcome back, and thank you again for being a sponsor.
Thank you too, John.
So tell my viewers what kind of activities that you go out and promote.
Well, in addition to clinical services, we do a lot of clinical work and therapy. We also do a lot of programming after school hours, summer programming, and during school breaks. We have a variety of groups that we run. We have a boxing group where we partner with a local boxing facility in Providence. We have an expressive arts group. We have a social skills group. We even have a bike group where we got some grant dollars and we utilize the East Providence bike path to take kids out.
Nice.
We have a bike for each kid that wants to go. We do a sports group where we rotate different sports to introduce different things to kids that they might not otherwise be exposed to. We've had a hiking group, and you know, a lot of times we just look at the trends of what are kids interested in, but we really try to give them some structured time. One of the things my mom always told me was an idle mind is a devil's workshop. And so we really need to make sure that kids have things to do and that they have a sense of belongingness and that they feel part of something. You know, that's really meaningful for them.
So here's a $64 question. What is the cost for a child to go into these groups?
Well, the majority of the groups we are able to bill health insurance. So there really isn't an out-of-pocket cost. It's billed through insurance, or if they're part of some other programming where they get a referral to us.
Mm-hmm. Now, when a child comes there, gets into a group, how long can they stay?
The kids are usually with us for about 6 months.
Okay, very good. How do I get in contact with Tides?
Someone could call our main number. It's out of our West Warwick site. That's the administrative office at 401-822-1360. That's 401-822-1360. Or visit us on our website. We have an email link at www.tidesfs.org. TIDESFS.org.
And somebody can put a question in there, like a
Correct.
callback or something like that? Oh, that's fantastic. And again, I want to thank you for what you do for our kids.
No, thank you, John.
Because if it wasn't for an organization like yours, we'd be in worse shape than we are today. So thank you from Recovery TV. The work that you do and your staff is more important. Make sure you keep your staff. Thank you, Beth, and thank you for Tides. You've been listening and watching Recovery TV. I'm your host, John Tassoni. This is the Voice of Hope. We'll see you next week.
You know, every week I work in stadiums filled with thousands and talk to thousands more on the radio, which means people who come from every walk of life. And I know that many, like my own family, have grieved over loved ones caught in the grip of addiction. 8 years ago, we lost my nephew to an overdose. But I've also seen in friends and even fans who've shared their stories, others break that hold and regain control of their lives. You can do the same. Please know you're not alone.
East Bay Recovery Center in Warren connects people in recovery to the supports and activities that make long-term recovery a reality. People with lived experience work to engage individuals and serve as a guide for new recoveries. The Peer Recovery Specialist's aim is to engage high-risk individuals being served in the community to vital treatment and services and follow-up to ensure the connection to treatment and services is maintained. For more information, visit ebcap.org or call 302-6231.
If you're struggling with addiction to pain pills or heroin, it's time to call Groups Recover Together. Groups will get you the medicine you need to feel better.
When I took Suboxone, I felt just like able to function, no sickness, no, anxious feeling.
And we'll give you the support you need to build the life worth being sober for. The time commitment is minimal, just 1 hour a week. You can meet with us in person or virtually. Call now to get started.
I started getting in trouble when I was real young. I was bringing knives to school in the 3rd grade. I started hanging out with the wrong crowds. I envisioned that if I wasn't dead by 26, I'd be in jail. I never had plans past that. Tides give me the opportunity to start a new life fresh. So now to be 28 with 4 children, married, manage this restaurant, living in a house, it's a miracle. Life is incredible, and Tides is who I have to thank for that.
When it comes to home improvement, you just don't know who to turn to, especially when it comes to a painter or contractor. Years ago, I found a company I could trust, Lopco Contracting. Lopco has been painting and repairing homes in southern New England for almost as long as I brought the news into those homes. From replacing doors and windows to fixing leaks and rotted wood. For a contractor you can trust, call Lopco now, 1-800-PAINTING, or log on to LOP as in professional, cocontracting.com for the personable, particular professionals. Salud.
Sunday mornings, join host John J. Tassoni Jr. for Recovery TV, the voice of hope for addiction and mental health issues. Tune in, tell others. Sunday mornings, 11:30 on CW Providence and 9:30 on MyRI TV. Brought to you by AdCare.